Yo, welcome back in, all you DPC rebels and resistant fighters. Dr. Shane's back with another Friday 5-minute magic tip. Hope you guys are doing well. Looking forward to a great weekend. Hope you had a great week. I'm looking forward to some hanging out and some rest myself. Valentine's weekend, if that means anything to you, just thinking about that. Give you a little heads up on that. Today, I want to chat a little bit about a common thing we hear quite frequently in the DPC world. A common fault, common problem. You hear a lot of this from academics. You hear a lot of this, and even brokers and advisors bring this up a lot. Uh, the reason that DPC doesn't work is because you're paying twice. If you have insurance, your insurance already covers primary care. So why do you want to pay again for DPC? Because your insurance covers primary care. So technically, you're paying for it twice if you pay for insurance and you pay for DPC. Question, is that true? Have you really thought about that? Um, let's dig into that a little bit. And first, by asking, does your insurance really pay for primary care? What does it pay for in primary care? A lot of people will say, oh man, well, I get a full physical. My annual physical is covered by primary care. Is it really? Really, though? Do you not get any bill? Do you get any labs? Do you get anything done for your physical, and you get literally receive a zero bill? Um, I know when I used to work in the insurance business, when I used to have a clinic that did dealt with insurance, if you complain of any issue, if you have any complaint, my knee hurts, my ear hurts, if you have any complaint, any problem during your physical, it's no longer annual physical, it's a problem visit, which is no longer covered by your insurance as a annual physical. So that visit has turned into a problem visit, or you're going to get billed for a physical and a problem visit. So you're going to end up getting a big fat bill in the mail. And the biggest part of that is if you have not met your deductible, your out-of-pocket max, guess who gets the bill? You do, the patient. So a lot of times these physicals, even things like colonoscopies, you think, oh, if it's normal, then I don't have to pay. Correct. If they find a problem, that changes what the bill is. So you have to think about that when you're using your insurance. If you think it's going to pay for primary care, the other big, fat, gigantic monkey in the room is deductibles. What is your deductible? What is your out-of-pocket max with your insurance plan? Uh, the average deductible right now for the ACA plans, bronze plans, is $7,400. A silver plan is $5,300. For employer plans, the average roughly $1,800 for deductibles. What does that mean? Well, you're paying out of pocket till you meet those deductibles. I don't care who you see in your primary care physician, the urgent care, the ER, the surgeon. It doesn't matter who you're seeing. You are paying out of pocket until you meet those deductibles. And I don't know why people can't understand that. But if you go see your primary care physician 5 times, you haven't met your deductible, you're cash pay. You are paying out of pocket. So you're already paying twice, if that's what you want to call it, until you meet that deductible. So you can decide whether you want to have a primary care physician who's in your network and you're going to pay $300-$400 every time you see them because you haven't made your deductible and you're paying high dollar insurance rates, or do you want to spend $1,000 for the entire year of unlimited primary care with your DPC doctor with discounted meds, labs, everything you can do in the office, is included, no copays, no deductibles that you have to worry about there, totally outside of the insurance plan. So people don't think that way. They think, oh, I've got insurance, so it's going to pay for my primary care, but you don't realize you have a $7,000 deductible, which means you're out of pocket. You are paying until you meet that deductible. Yes, it may cover a physical if you just sit there and have zero complaints. But if you have any kind of issues, you are paying out of pocket. Now, Medicare is a different beast altogether. Their copays, deductibles work a different way. So not really talking about Medicare in this example. So just think about those deductibles. How many people in a year? Most people don't even meet their deductible. maybe 10%, 20% of the entire population meets their deductible. So they're literally paying out of pocket for those visits. So you just need to think about that. And this is commonly brought up as a fault of DPC when you add it with an insurance plan that you're already covering primary care. So you're just adding that cost. Self-funded plans done correctly obviously would take out the primary care when you're doing DPC. So it would work much better through a self-funded plan. Certainly paying more money to have a BUCA type plan, which is a big brand box, big name box brand insurance, and you put DPC on top of it, certainly going to be way more expensive. But you have to think about the advantages of DPC: more access, more time, discounted labs and meds, the e-visits, video visits, all the things you get with the direct primary care, which traditional medicine just cannot even keep pace with. Being able to have same day, next day visits, all the things that you are going to benefit from having your primary care DPC physician. So think about that as you move forward. If you hear anyone talking about DPC paying twice, this is quite frequently talked about. So just wanted to share this with you, so you have some ammunition and things to think about. The deductible, the out-of-pocket maximum, and the types of insurance they may have, and that may benefit them still using DPC, even with their insurance. So think about that in the DPC world. Share that with your broker advisor. Share that with employers you're in your community. Hope you guys have a great weekend. I'll try to be back with you guys again next week with some new hot topics. Till then, you guys have a great weekend.